What is anterior cord syndrome? Anterior cord syndrome, also known as anterior spinal artery syndrome, is syndrome caused by ischemia of the area supplied by the anterior spinal artery, resulting in loss of function of the anterior two-thirds of the spinal cord. The region affected includes the descending corticospinal tract, ascending spinothalamic tract, and autonomic fibers. It is characterized by a corresponding loss of motor function, loss of pain and temperature sensation, and hypotension. Anterior cord syndrome is the most common form of spinal cord infarction. The anterior spinal cord is at increased risk for infarction because it is supplied by the single anterior spinal artery and has little collateral circulation, unlike the posterior spinal cord, which is supplied by two posterior spinal arteries. A 58-year-old man undergoes operative repair of a descending thoracic aortic aneurysm. There are no intraoperative complications, but postoperatively the patient is found to have new-onset neurologic deficits. Imaging of the brain is normal, but MRI of the lower thoracic spinal cord reveals ischemic infarct of the areas shown in the exhibit below. Lower extremity examination of this patient is most likely to show which of the following neurologic findings? The correct answer is decreased crude touch, decreased pain sensation, normal proprioception, and decreased motor function. This patient's thoracic aortic aneurysm repair has been complicated by ischemic injury to the anterior two-thirds of the spinal cord. This area is perfused by the anterior spinal artery, which receives blood flow from segmental arteries, for example, intercostal arteries, arising off the thoracic aorta. Disruption of circulation to this area classically results in anterior cord syndrome, characterized by the following bilateral tract lesions and clinical signs: spinothalamic tract, loss of pain temperature, lateral spinothalamic, and crude touch, anterior spinothalamic, sensation 1 to 2 levels below the lesion, anterior horn, lower motor neuron, flaccid paralysis and muscle atrophy at the level of the lesion, lateral corticospinal tract, upper motor neuron, paralysis below the level of the lesion. Flaccid paralysis from spinal shock, that is, temporary loss of all distal spinal cord function, occurs initially, but upper motor neuron signs, for example, spasticity, hyperreflexia, subsequently develop over days to weeks. As in this patient, the dorsal columns are typically spared due to intact circulation from the posterior spinal arteries, preserving proprioceptive, vibratory, and light touch sensation below the level of the lesion. Decreased crude touch, pain sensation, proprioception, and motor function. Complete loss of all lower extremity sensation due to injury of the spinothalamic tracts and dorsal columns, and motor function due to injury of the corticospinal tracts, as can occur in spinal cord transection. Decreased crude touch and pain sensation. An isolated defect of crude touch sensation or pain temperature sensation could occur only with isolated injury to the anterior or lateral spinothalamic tract respectively. Because the anterior spinal artery also supplies the tracts, for example, corticospinal tracts, surrounding the spinothalamic tracts, it is extremely uncommon to have bilateral injury to only the anterior or lateral spinothalamic tract. Decreased proprioception and motor function. Diminished proprioception and motor function can occur with simultaneous injury to the dorsal columns and corticospinal tracts. A classic cause is subacute combined degeneration of the dorsal and lateral spinal cord white matter, which is seen in vitamin B12 deficiency. Decreased proprioception. Selective loss of proprioceptive along with vibratory and light touch sensation occurs with isolated injury of the bilateral dorsal columns. A classic example is tabes dorsalis, a form of tertiary neurosyphilis that causes damage to the dorsal columns and dorsal nerve roots. Educational objective. Ischemia of the anterior two-thirds of the spinal cord can occur with disruption of the anterior spinal artery blood supply. The resulting anterior cord syndrome causes bilateral distal loss of pain, temperature, and crude touch sensation from injury to the spinothalamic tracts, and paralysis from injury to the lateral corticospinal tracts.